Hi, everyone. Welcome to Resolve's Kitchen Table Conversations. Welcome to our table. Resolve was founded in 1974 around the kitchen table of Barbara Eck. So this series is really a nod to our history and how approachable talking about these topics should and could be. And so we gather around this table with some more experts. We're here today to talk about medical treatment with IVF, talking about how to approach that. Should you do it, how to consider it. Maybe you've tried it and maybe it wasn't successful and you're considering if you should do this again. So we are here to have that conversation. I'm Barb Collura. I'm the president and CEO of Resolve, the National Infertility Association. And I'm joined by a really fantastic group. This kitchen table conversation, we are so proud to tell you that it's sponsored by Reproductive Medicine Associates of Connecticut, or RMA of Connecticut. They're a medical practice in Connecticut, and they partnered with us on some of our kitchen table conversations. So with that, I'd like to introduce who's around the table. And they're going to tell you a little bit about themselves, and then we'll jump right in. So April.
Thank you so much, Barbara. And I'm excited to be on this panel with all of these amazing people. So hello, everyone. My name is April Christina. You can find me on social media at I'm April Christina. And I have a blog also that's called I'mAprilChristina.com. I am currently from New York, but I currently reside in Long Island, which is still New York. A little bit about myself. I had my first menstrual cycle when I was 9 years old. So I was in the third grade, pretty much just trying to navigate, life, mathematics, English, those things that you think about when you're in elementary school. However, I was in the aisle with my mother trying to figure out what was the best sanitary pads to figure out and getting bathroom passes so that I'm not as embarrassed, being that I have to go to the bathroom every 30 minutes to 45 minutes. As time went on, I started throwing up. I was nauseous, had very bad leg pain to the point where I couldn't walk. My parents were very proactive with me. I had a pediatric GYN. They then thought that I had blood clots. So they kept checking me for DVTs or possible pulmonary embolisms. And of course, to no avail, that wasn't the case. So in my late 20s, I was officially diagnosed with stage 4 endometriosis. I didn't really understand. I didn't know what that was. I didn't know anyone else at the time that had endometriosis, but I continued to advocate. I had a surgery. My last and second excision surgery was 7.5 hours long. My endometriosis had actually spread to my bowels. I had no clue because I was still urinating. I still had regular bowel movements. Everything was fine. Fell in love, now married for almost 4 years in March. Everything was amazing. I was already an advocate for endometriosis. I was going to Reproductive Endocrinologist and immunologist, and my AMH was fine. I had amazing follicles. So I thought everything was great. I had my endo at bay. It's time to, enjoy my first year of marriage. Now it's time to have kids. When it was time to have kids and I went back to my RE, my AMH had plummeted to 0.7. And needless to say, I was devastated because I did everything that I could do and that I felt that I was doing once I was officially diagnosed with endo, just to be as proactive as possible. So my husband and I decided in 2020 to undergo our first IVF cycle. Because I'm in my mid-30s, I did not want to do any other treatment other than IVF. I just wanted to go straight to treating this aggressively as much as possible, knowing the information that I did know from being in the women's health community. Unfortunately, my first IVF cycle failed. It did not work out. I was devastated, to say the least. Then I ended up finding out that I had fibroids, and before I started my IVF cycle, my fibroids was like the size of millimeters. Like it was like 2 or 3 of them. And then by the time my IVF cycle completed, I had a whole bunch of fibroids that I didn't even know existed. So to say the least, I was devastated again. So here we are today. I'm just waiting for my myomectomy so I can get the fibroids removed, so that I can start my second cycle. And being an African American woman, I just wanted to, one, talk about women's health as a whole on my platform and really just educate women to not be ashamed and to not be shy and to not be embarrassed, more importantly, because this is a health condition. And a lot of times we shy away from it because within our community, we're supposed to just reproduce. And as women, we're supposed to have kids and just really understand that it is a condition and there are amazing people out here that is here to assist and to help.
Well, April, I have to say we could just shut down right now and people will have, first of all, learned so much and then have felt like, wow, there's other people out there that have maybe gone through the same thing and my heart just breaks.
Yeah.
But I am so honored that you chose to tell your story and speak about it, because that's what we do at Resolve, which we're trying to help people find their voice. And we know the power of every single person's personal story and how
Absolutely.
makes such a difference. So thank you for your advocacy and speaking up and sharing. And I can't wait to talk
Thank
more.
you.
So let's get
Yes.
let's get our introductions here. Nathalie, tell us where you're calling from and a little bit about yourself.
Hello, everyone. My name is Nathalie Carpenter, and I'm calling in from Connecticut, which is my new hometown as of June of this year. And you can find me on my blog at fertilist.com. I'm also on Instagram and Facebook at Fertilist. And I started this platform back in late 2016, early 2017, when I was going through the beginning, or what felt like the beginning stages. It was really like the first few years of my fertility journey. And I felt incredibly alone. And I used the blog as a platform really to try to branch out and connect and build community. This was also around the time that I found Resolve. To that end, my story is a little something like, it began in 2014 after getting married in 2013. We were not trying, my husband and I, and we were guided by a friend, or I should say I was guided by a friend to see someone just to make sure that everything was all right with my fertility. So I did, and I fell into infertility, and
I like how you said, I fell into infertility. Wow. I mean,
didn't know what I didn't know, right?
Yeah,
And 5 doctors later, and multiple years, 2 IUIs and 3 IVFs later, I welcomed home, my husband and I welcomed home our rainbow baby. And our journey has been on pause, really, because my last transfer, which was in the early part of 2020, which was my 4th IVF, resulted in a failed transfer. Again, as April mentioned, offline. I don't love that term, but for all intents and purposes, I'll just say it. And
we need to figure out another word, Nathalie.
We really do. Word.
let's put a pin in that, because that is why saying, like, just the term failure, like, oh yeah. So Nathalie, what happened? What happened in 2020?
So now, I'm not trying. I'm okay with where I'm at the moment. I reserve the right to try again, through assisted methods. I think I just needed a little bit of a break for my mental health and to really reconnect with my family. There's a lot of stress happening in life right now in general. I just didn't want any more of it, particularly because IVF can feel like a second job. But here I am. I'm here to support, and I'm so grateful to be here today. Thank you so much, Barb and Resolve and RMA Connecticut for making this possible.
Oh, well, I'm so honored that you've chosen to tell your story, and with your Fertilist blog. Thank you for helping, so many people and being there for them. So Dr. Hurwitz, hello and welcome. Where are you right now? And tell us what you've been up to.
Thanks, Barb. What a great group of people to be with. I'm very proud to be here with you guys, and I'm proud of the bravery you've shown, and proud of everybody who's joining us, watching us on record tonight. It's hard to walk through this door. So that's the hardest part sometimes. So I'm proud of everybody. But to answer your question, Barb, my name's Josh Hurwitz. I'm an REI at RMA Connecticut here in Norwalk, Connecticut, where I also live. But I don't consider myself an infertility specialist. I consider myself a fertility specialist, right? I think there's power in words, and that's what I do all day long, right? So I like that part of it better. Very passionate about the journey for patients. We've heard two very powerful journeys, and there's a lot of stories out there, and it's hard to be a fertility patient. It's hard to want something so badly that you're willing to do anything that you want to get there. It's hard, right? And so my job is not just to do the science and not to do my best and utmost medically to help you, but to help you along the way, right? To help you along the way. And we believe in the patient experience is just as important as our pregnancy rates. They're sort of like the two core missions we have, right? So I love getting the word out. I'm happy to be here tonight. I love to answer any questions about IVF and the journey and everything, and how we can make our experience better for patients in the field, but also sort of what questions do you have about IVF? What are the risk alternative benefits? What are the pros and cons? All that kind of stuff. I'm very excited to get into it with this group of people. Thank you.
Awesome to have you. Thank you so much. So I'm going to start with expectations, because April talked about being, devastated. Nathalie, how many years you spent on that journey. So I want each of you to take a different slice of expectations, but I'm going to start with Dr. Hurwitz. When a patient walks in the door and, what are things that you wish that they knew, that they come in with maybe some preconceived notions? If they're a candidate for IVF, or they're coming in to be evaluated for IVF, how do you tell us about those realistic expectations that you try and set? Because we hear so often that patients are like, oh, number one, I don't even want to walk in the door because the doctor's going to say you have to do IVF. And number two, I think I just need one IVF. Like, isn't it just one time that I'm going to do this and I'm going to get pregnant? So I would love to hear from all of us on this, because this is such an important part of this journey. So take us there, Dr. Hurwitz, on setting those expectations.
Thanks. I appreciate it. That's a great question. And one I think about a lot, because I talk to patients all day long, right? So first expectation when they come in the office, they think you only have to do IVF. That's clearly not the case. There's lots of treatment options from the lowest to the most high tech, and we offer all of it. So that's number one. I don't want anyone to be scared that that's the only option they'll have. Number two, I think that there is an expectation that you can snap your fingers and this stuff works. All right. Everything I do is a process. When I first meet with a patient, I spend an hour with them, whether it's Zoom or in person, like in the old days before COVID, right? I spend an hour with them explaining to them the process. Now, we have a great team. We have a great care team taking care of patients, shepherding them along the way. But things take time, from meeting a patient to being in a cycle, no matter what it is, whether it's a Clomid IUI or it's an IVF with chromosome testing, okay? It probably, from meeting someone to being in cycle, you're looking at 6 to 8 weeks. And I think that's an important expectation here. Nobody comes to me on a Friday and is an IVF on a Monday. It doesn't work like that. So I think that's a very important expectation. And the reason why, it's not to be mean or anything, it's really a lot has to happen. We need a lot of evaluations, a lot of counseling. We have to make sure you understand everything. We have to get insurance all squared away so that there's no surprises there. Nobody wants any stress financially as well on top of all this. And a lot has to happen to make sure it goes right. So my mantra, the way I kind of live my professional life, is that if you do everything right thoroughly from the beginning, it all rolls downhill the right way. Mm-hmm. So you have to give us a little time to get in the cycle. That's a very big expectation that I think is important to talk about.
But go ahead. No, I was just going to say, like, do you tell people, oh, it's only going to take one cycle? Like, how do you set people up so that they don't think that?
So in my, old age right now, I'm getting used to telling people, hey guys, listen, Here's where some people have thought things are going to go, but they go in a totally different direction. So I'm bringing up some of those misconceptions in the consult these
All
days
right.
more than I used to. And I think that this is a very prescient conversation. So here's how I view treatment cycles, whether it's the lowest, the mediumest, or the highest level of treatment cycle. There is no such thing as a magic cycle. That doesn't exist. There's no guarantee. There is no magic cycle. It's a process. But I look people in the eye and I know everything about them at that point. And I say, but listen, if you stick with this process, you'll be okay. In other words, I don't see any major obstacles for you. I don't see any horrible red flags that this will not work for you. And as long as you stick with this, you'll be okay. Can't promise you any one cycle, but you'll be okay. Now, there are some times when that's not true, when their ovarian reserve is poor, or they have a uterus that has a lot of challenges to it. Lots of different examples of things that can really challenge patients. And I'll tell patients, listen, when I don't think that's the case for you, I'll tell you, I will manage those expectations as well.
Wow.
So I'm going to talk a little colloquially here. Like, if I think you're screwed, I'll tell you. I don't say it like that, obviously, but
Yeah,
that's the idea, right?
Right.
And so then I also say to patients, though, if you don't hear me say that, consider me optimistic and confident. And that's what I want you to take away from this conversation. But I can't guarantee you any one golden promised guarantee cycle. That doesn't work that way. But as long as people stick with it.
Yeah. What's that, Nathalie?
I said, I love that you're not guaranteeing. My first experience, as you were saying, you were asking the question, Barb, was, wow, my first experience walking into a doctor's office was like, all right, I have no idea what I'm doing. I'm going to outsource this to this doctor and he's going to tell me everything to do and I'm just going to do it and I'm going to wind up pregnant. And plus, I looked great in terms of all of my tests. And I received the expectation of, oh, you're going to be an easy case. You're going to be pregnant in no time. And so my expectations were like, oh, this is okay, cool. So my expectations were up here. And the reality is like, okay, I needed to level them down here. And so I love that you're being real about the expectations and not promising anything and not sharing that there's a guarantee. I also heard you say that you provide counseling. That's amazing. I wish that that had been something that was available because I kept the mental and the physical piece so separate and that really worked me.
Nathalie, thinking about that, just a really quick question that popped in my head. When you started this process, how many years, or I'll say months, how many months or years did you think it was going to take?
Once I actually saw a doctor, I thought I'd be pregnant within a year. I was like, oh, and it was like a slow, easy thing. It was like I don't think I can actually say some of the things that like my very first doctor said to me. I'm like, I'm pretty sure, no, can I just say it? You can edit it out if it's inappropriate.
It's us ladies talking here, no big deal.
Okay. My first doctor said, okay, this month, have your husband shoot left. That was his whole thinking in terms of like, okay, this is how we're going to go. And then he was quick to say, all right, you have a history of, an appendectomy and a strangulated bowel situation, and you don't show anything on your HSG. It looks great, but let's go in and make sure there's no scar tissue, which is why I ultimately left the first doctor and moved on to the second one, because I was like, I am not an experiment. So
You started to feel that way.
I really did. I really felt like I was, that was why when I went to the second doctor and the second doctor said, oh, no worries. Yeah, that was, very invasive. Don't worry. We're going to get you pregnant. We're going to get you pregnant quickly. You're going to be fine. One or two IUIs should do the trick. And I thought, oh, all right. So that's the answer.
I wish I had that crystal ball. I don't think I could ever say that to somebody in X amount of treatments, in X amount of time, you're going to be fine. I wish I had that crystal ball.
So Nathalie, here's what I want. I'm going to go to April here, but Nathalie, I want to come back to you because I bet you could write a book. I'm listening to you. I bet you could write a book on what I wish I had known, right? But I want you to give your best advice to our listening audience on that. April, thinking about expectations here.
Mhm.
You were a proactive girl. I feel like you went into this knowing a lot more than I did or other people did. I don't know. You already had gone through hell and back, but you already knew a lot about your reproductive health when you proactively said we're going to a reproductive endocrinologist. But tell me about the expectations, because you were still devastated with those surprises. Of course you were.
Well, one, I was so proactive that I didn't think that I was going to need fertility treatment. So that's how proactive I was. So that was the first level of devastation. But also for me, when I do anything in life, I am really big on relationships. So for me, when it comes to a relationship with any of my physicians, especially with me already coming in with a chronic condition, I want to be as comfortable as possible. So with that, I don't like any unspoken expectations from myself, and I don't want any unspoken expectations from my physician. So with that being said, I'm really big on black and white. Give me the most positive and optimistic way that we can approach this, and let me know the most extreme way that I may have to deal with it. That way, because I overthink and because I am as proactive as possible, I like to make sure that I have from A through Z every way possible. Although obviously, as we see, there was a way that I didn't even know that we was detouring. We went between A and B. So we're like an A and a half that I didn't know it expected. But at least I was able to understand that I more than likely would have to do another cycle. And that for me gave me the expectation of understanding that there may be something else. So for anyone that's actually watching this, like, it's really, really good to make sure that you have those questions. There are no wrong questions. There are no dumb questions to really ask, because when you really go home and you sit down with your partner, or you sit down by yourself, especially the by yourself part, there's so many things that you may have expected to happen in that doctor's visit that you now internalize. And then now here comes the mental and the emotional aspect of it. But unfortunately, that physician may not have even known that that was an expectation that you were requiring of him or her, because they didn't really know how you felt. So for me, that's really how I approach things. I don't want any unspoken expectations before I leave that office. And granted, yes, they do have other patients that they have to take care of. So I try to be as mindful of their time as possible, because I don't want to raise my anxiety from the time that I'm in the office. So that's really with me how I really approach everything when it comes to my fertility journey, is really making sure that I have that pristine relationship with my fertility specialist so that we can really figure out what the next steps are based on these expectations. And a lot of them are in my head, but they are valid because they're there.
Well, Dr. Hurwitz, so gosh, April.
So well said, April, because I get blindsided about stuff. I don't know anything that's going on in here. And then I found out a week later that I didn't talk about this, but you didn't bring it up, but I didn't know it was important, right? So I love that you said that.
Well,
I
Dr.
think that there's a couple of expectations that I think are very important for patients to have, right?
Yeah.
You should fully expect that your doc and your team has a plan to help you, and you should fully expect that they care about you and your outcomes. And if you don't feel that way from your team, you should go somewhere else, right? And they're like, oh, this is great, I'm gonna be fine, right? Because it only sets me up for failure. So it's not like I'm some saint here. It only sets me up for failure. So I've learned over many years of doing this and a lot of experience that the more I do this up front, the better off we all are. It's like if you set it up thoroughly the right way at the beginning, everything rolls downhill the best way.
Yeah, so let me thank you, Dr. Hurwitz. So Natalie, April, I want you guys to talk about lessons learned here. What do you wish you would known? Like, what are you going to tell? It's the old, what do you tell your future or your past self? What's the piece of advice that that you wish you would know, Natalie?
Well, you brought it up in the very beginning. I wish I had known that IVF wasn't a guarantee. I wish that I had known early on that if I failed, and I failed, I have failed 3 out of 4 IVF cycles, 2 outright, like 2, to your point, Dr. Hurwitz, I did not even make embryos. the last two I did, and there weren't many, I will say that much. I wish that I had known after those first two IUIs and those two IVFs didn't go my way at all. I wish I had known that it wasn't going to be the end of the road. I had, at this point, I had a doctor that broke up with me who said, yeah, she said, I think that we should try a third IVF, but if you fail again, I don't think I can help you. So I said, all right, we're done. We're done here. But I remember thinking, is this the end of the road? Like, what does this mean? And I wish I had known that no matter what, that there would be a path to parenthood if I was willing to look at options. And quite frankly, if I was just willing to just see that there's always a path, it just doesn't always look the way that you thought. I mean, I never thought that doing IUIs or IVFs would have been a part of my journey in the very first place.
Wow.
Yeah.
April, what do you think? What advice?
Yeah, two things. The first thing is, this is just the beginning. And I say that because when you do your cycle, and I'm still like a babe in this fertility journey. When I did my first cycle, I was like, woo, that is done. I did my retrieval, and by the time I left my retrieval, and I was literally, my husband was parking the car, I found out that I had no viable eggs. Like I blinked my eye. Listen to me, guys. I literally went from Manhattan to Long Island, blinked my eyes, took a nap, because you're under anesthesia, took a nap, woke up to the phone ringing, and I found out I didn't even get into my apartment yet, and I found out that my cycle was done. And I was in such shock because I thought I had just started. I was like, we didn't even get the sperm. Like we didn't make anything yet. Like these are all these things that is running through my mind. And now it's about to be a year later now. I'm realizing that I'm still in the beginning. And a lot of people think that when they start their first cycle, this is the beginning, and then you're starting your second one and you're further along. Like there's so many different journeys on what the beginning is. And that doesn't necessarily mean that it's defined by just having your first cycle. So that's one thing that I'm learning from myself. The second thing is something that I had a motto when having endometriosis is your pace, your race. There's no other person that's on this track but you.
Yeah.
Everyone is so unique and different when it comes to the fertility community, which is why I love people like Nathalie and so many other people that I've met within the Resolve community that I can lean onto, because their journey is not the same as mine, but their journey gives me the strength to continue to carry my baton on, because they've lived their journey and they're going through it in a different phase where it'll help me continue to keep running. And those are literally my two things, as well as the fuel that really keeps me going and keeps me being able to be on panels like these and not break down and cry and smile and still find joy within the process, because it's still so very early for me, and I have to really count my blessings and really be thankful for the things that I have, so that when that time comes when my family is expanded, I'll be even more thankful for the next things that I will get.
So well said.
And I love you too, April. Just want you to know.
I love you.
And
you're about to make me cry. Like it's amazing. It really is. And it's so loving. And a condition like this that brings on so many negative emotions for you and your heart and your family, and you're pulled in so many different directions on really trying to understand. I cannot stress the importance of a community like Resolve and people like Nathalie that absolutely, when I say 200%, helps me. Like I text Nathalie, me and Nathalie can go for months without speaking. And then Nathalie and I can be on the phone for almost 4 hours, literally, and catching up. We speak every single day. And that's really the joy and the bond that we have, that we share, just from going through separate journeys, but still dealing with fertility at the same time. So that was my two things, the beginning and your pace, your race.
I
April, can I throw something on there? First of all, I'm
Mhm.
stealing your phrase, your pace, your race. I'm stealing it, just so you know.
Great.
Go ahead, take it.
I may or may not even credit you for it, just so you know.
It's totally fine.
So one thing that's important here is, and we talk about multiple cycles, it's not just trying, right? So while you had a tough cycle, I mean, that was tough. Your docs can learn a lot from that, right? There's going to be something there that they can learn from, whether it's extreme prematurity or failed FERT needing ICSI or whatever the issue was, right? They're going to abstract that information and they're going to tweak your protocol. They're going to optimize your next cycle. And that can be a stepping stone for your second one. IVF, we learn a ton about patients. So I'm not going to ever use the word failed cycle there, although that was a hard blow. I'm sorry. Because the reason why is you're going to be able to use that information to fix the next one.
Absolutely.
All right. So that's an important, people should hear that. It's not just, oh, throw something at the wall, see what sticks. Like, we're using information to optimize the next cycle.
Yeah, that's
correct.
Awesome. That's awesome.
Yeah.
So April, you know, you and Natalie have this love going on. I started volunteering for Resolve in 2000.
Mm-hmm.
2000. So it's 21 years ago. And I am dear friends with the women and you know, their partners and the women I met 21 years ago. And we still, there's like 12 of us and we still keep in such close contact. So
it's such a sisterhood. It's such a sisterhood. It's one that's undeniable, unmatched, that, I mean, I couldn't have asked for a better community, to be honest. It's unfortunate, but I couldn't have asked for a better community because it really makes a difference. Well, and that's amazing.
Yeah, so let's talk about that. Natalie, you talk about, you know, people need to know they're not alone. I'd love, Dr. Hurwitz, what do you, like with your patients, what do you recommend in terms of counseling? I mean, at Resolve, we have free support groups. Pre-COVID, they were meeting actually in person. I know you guys at RMA of Connecticut do all kinds of cool things and yoga and stuff like that. And now we have a lot of virtual support groups. You guys talk about that. Talk about the mental health piece of it and that why connecting with a community has helped.
Sure. Hard things are hard. People need help doing hard things, right? By definition, right? And human beings are social and we need not only peer support, but we also do need professional support too. So I think one of the things that we're great at my practice is taking care of the whole patient. I always tell patients, you're not just an egg, you're not just a sperm, you guys are people, right? And you need to be supported through this practice, right? Through this process. So, I mean, I think that me and all my partners and all the healthcare providers, we really take an active interest in rooting for our patients big time, and that comes through. But we also have 2 mental health professionals on staff that are under our insurance. So if you're our patient, you should be able to see them without extra cost. And in the old days, it used to be in person, now it's on Zoom, but it's fantastic. We also have this amazing award-winning support group called Ladies Night In. I'm going to give Lisa Rosenthal, our mutual friend, a big plug there. It's fantastic. And I cannot tell you how many of my patients that have become lifelong friends through it, which I love matchmaking through that. I think that's awesome. And, you know, friend-wise. And also just helping people get through it. Wow, there's somebody who's ahead of me and they're going to pull me forward, and someone behind me and I'm going to pull them forward, and I'm going to meet some besties and we're going to walk down the path together. I think that's incredibly powerful. And by the way, some of our most successful groups have been couples or for the husbands, by the way, because us men, like, we're not like awesome. We're not great at this thing, you know, in expressing, and we get frustrated. We can't fix things for our partners rather than explore our own emotions, right? So this has been a great thing that we've done, and kudos to Lisa and her team for doing that. We also have acupuncturists on staff. We have free fertile yoga classes. We have nutritionists. I mean, this is something that's in our DNA. It's not just like, you know, total high quality, top-notch medical stuff, but we want to treat the whole patient and make sure that the experience and the support is there. And I hope everyone's finding that out there in the world where they're getting help from fertility specialists. I really hope that. But this community here, the explosion in social media, big hugs around the field of both, you know, motivational, aspirational, nurturing, informational. I mean, that didn't exist. I'm not that old. It didn't exist when I first started. And I just think it's a fantastic thing. And I'm so proud of the community for being able to do that. And I love being on with you guys. It's fantastic to see that.
April, Natalie, what do you think about support and connecting, and how important that is, or how it's made a difference for you?
I think actually, I know that I didn't know what I didn't know going in. And I wanted to compartmentalize all of the things. And I think that a big message that I would share is that it's okay not to understand exactly what's happening when you're in it. Sometimes it takes a second to like be past the cycle, to regroup and say, what just happened? And it doesn't mean that you're not intelligent or that you just didn't get it. It just means that you had to survive the process and you had to process it in your own way, or at least that I'm projecting right now. I'm just telling you how I felt. I really felt as though I went through my first 2 IUIs and really my first 2 IVFs, and then it sort of just hit me. So I think it's understanding from the get-go from great doctors like you, Dr. Hurwitz, that say, at some point, you may struggle with your mental health around this, and that is completely normal.
Oh, yay.
Right? And
big.
when that time comes, having resources like Resolve, like the Instagram community that Resolve is also very involved in, that provides us the support that we need. And if we need to take it the step further and see a mental health professional, having those outlets and those connections, wow, from a provider, that is like amazing. I haven't ever gotten that experience directly, but I very much respect and appreciate my most recent providers. But I will share that I think that RMA Connecticut is definitely doing something right if that is what you're doing. So I love that sense and support of mental health and community, and I love that we're talking about it, because nobody was talking about infertility, IVF, let alone mental health in 2017, maybe not even until like a couple years ago. So grateful that we can have kitchen table conversations like these to have those chats.
You know, I love everything about what I do. Like, I'm supposed to be doing this. I really feel that way, except for one little piece of it. You ready? Is a little bit in the closet, so to speak. It's a little bit, some patients don't want to put themselves out there. You know what I'm talking about. And I love that this is now here, right? That this is out there, that we have all this great social media, because when you open up and talk to people from the heart, they'll open up to you and talk from the heart, right? And that's what social media is doing. It's starting the conversation. Look at this wonderful bond you guys have, you know, just through, you know, started on a little screen, right? But it opens up for my patients to be able to open up themselves. And so it's a good starter. And so I love that we're evolving in that way, because everything else about what I do is amazing. I just wish it was a little bit more, you know, I don't know. I don't know what the right word is.
I think that it's also amazing that, Dr. Josh, that your RMA have the complete wholeness. It's not just a fertility clinic just to do IUI, IVF, or whatever fertility options you have. You have the yoga, you talked about acupuncture, you talked about mental health. It's literally for the whole body. So even if there aren't people like an April Christina or a Nathalie, you can have a Jill with her husband that want to share that opportunity with their spouse, but don't go on social media, but then they actually have everything in one package within the fertility clinic, which actually gives them the inspiration and the love and the life and the feeling to continue to keep moving forward. Because every fertility clinic is not like that. So I really wanted to applaud you guys for that, because I think that that's absolutely amazing. And it really encourages couples to continue to keep going, or even people that are deciding to be single moms and fathers by choice. It really gives them that extra oomph to keep going. I really am a firm believer of support. I absolutely joined support groups last year when I first started, because although I had the information, I still needed the emotional help, and I still needed the emotional guidance. I needed to lean on other people like me that was in the journey, because at that point, I didn't even care that I had a social media platform. I didn't even care that I had a blog. I didn't care about any of that stuff. I cared about April, in April's heart. And what needed to be fed at that moment was to be loved on by other people and to love on other people at that time as a patient. And I think that sometimes like we miss those moments because we're always so on the go because we're like, we want to have a kid, we want to have a baby, we want to expand, we want to get all these embryos. And it's like, while you're constantly going, you're not a machine. And eventually, although you're pushing your body to keep going, mentally and emotionally, sometimes in hindsight, you're breaking down. So you really need that extra power to really push forward and to know that you can make it and that you can keep going and to really understand with a clear mind and head what type of resources and what your next steps are. So I definitely did take a step back. Plus I did my cycle during a pandemic. Plus I was still working. It's all of those different things that a lot of people don't talk about, that it's not just a cycle. And who do you lean on? You know, who are your support system? And do you need to alter your support system? I mean, you don't have to suffer in silence, nor do you have to think that you're by yourself. And, you know, what are those next steps are? So I definitely did lean into support heavily during 2022. I did acupuncture. I also did have my own personal therapist as well, because the thoughts that were in my head didn't make any sense. And I needed someone to help me understand, no, it makes sense. Like, you are where you are right now, and it's totally normal. And I needed someone to really validate that and help me navigate what that looks like, because you could have all of these thoughts in your head and then you think you're going crazy, and then you'll psych yourself out of a perfect opportunity to have a relationship with your spouse, with your RE, and to continue the journey. So that was very vital and important for me.
So I'm gonna, gosh, April, thank you for sharing and opening up. We need to wrap this up, because I can tell the four of us, we probably
can keep going.
Open a bottle of wine, and you know, we're gonna be here another couple of hours.
A long day. I could use a glass of wine. That sounds fantastic.
But you know what? We're gonna wrap this up. But I'm gonna ask Dr. Hurwitz, because April mentioned the C word, COVID. I can't let that go without having you, a specialist here. What are you guys telling your patients at RMA Connecticut about vaccinations and so on, with people coming in who are wanting to get pregnant?
Thanks for that. I'd love to get this message out. You know, only be another four more hours. No, just kidding. So basically, there's a lot of anxiety around about getting COVID while trying to get pregnant, while pregnant, and the vaccine. I can tell you from a reproductive medicine standpoint, it is absolutely clear and scientifically crystal clear that there is no negative impact on the vaccine on your current fertility or your future fertility or pregnancy. That is clear. We know that. Every week, new articles are coming out about the safety of the vaccine and trying to get pregnant, and fertility and in pregnancy. What we also know is that the risk to your pregnancy of catching COVID is really bad, right? Mm-hmm. Women who catch COVID in pregnancy are much sicker than non-pregnant women. They have worse outcomes. The babies have worse outcomes. So we're talking 30-week deliveries, we're talking stillbirth, things like that are increasing. And that if you have the vaccine, you are protecting your baby from even before conception. And that your antibodies pass through the placenta and the breast milk after delivery, and that those babies are born with antibodies. So wow. Imagine a baby's born in a hospital, and the baby, God forbid, caught COVID in the hospital, like this naive little, newborn. That would be horrible. So the fact that you can protect your maternal and obstetrical outcomes and your baby outcomes when it's born, it wow. really tips the scale very clearly. And the American College of OBGYN, the American Society of Reproductive Medicine, Society for Maternal Fetal Medicine Specialists, the CDC, I mean, I could go on and on, yeah. strongly recommend that any person who is trying to get pregnant or is breastfeeding should get the vaccine immediately. That is their strongest medical advice. So I can tell you what I'm telling my patients. I tell them exactly that, literally that. And I probably spend half an hour a day talking about the vaccine, trying to get people to do it because I care about people and I don't want them to get hurt, and not getting the vaccine is really hurting them.
Dr. Hurwitz, thank you for that message. I think people could go to the CDC website. I know they have yep. great data. ACOG, you mentioned the American Congress. They have that's acog.org. They have information. and certainly Resolve, we have some information in terms of where to get that. So thank you for that. All right, ladies and gentlemen, I'm gonna keep it to 1 minute each. Just say whatever's on your mind. Final thoughts, whatever you want to say, just jump in.
I'm so glad we're here having these conversations.
Just be kind to yourself, give yourself grace, understand that whatever pain you're going through is definitely going to birth purpose. Don't know what the purpose will be, but you will find that on the outside of it.
And there's a journey and a destination to this, right? So the destination is really important. So the journey, you'll do whatever it takes to get there, but it doesn't mean you have to be miserable during the journey, and it doesn't mean you can't have help along the way.
And your destination may turn out to be a little different than
Yep.
what you had maybe set out to do. And I think, I feel like the IVF journey is, or the family building journey is decision point around decision point. And every time you're thinking you need to make a decision, you need to be kind. I think, April, be kind to yourself. If you need support, if you need information, if you need therapy to get to the point where that it took my husband and I 1 year in therapy to make a decision. Oh my God, it's okay. It's gonna, just be kind to yourself. Gosh, I wish somebody had told me that. So
The path to parenthood, right, can look different for every single, it does
Everyone.
look different
it
to
does.
every person.
And
It's
yeah, no journey is better than the others either. Don't
Yes.
yourself up because that happened, so gosh, you guys, this has been, first of all, such a joy and a pleasure getting to know each of you a little bit better. Thanks for coming around our table here at Resolve. And I know that there are going to be many, many, many people who hear this and listen to your story maybe in the next weeks or months, or maybe even a year from now, and this is gonna be impactful for them. So thank you. Thank you, thank you, thank you.
So much fun. Thanks, guys.
you.
Thank you.